For our final video on the program, we're going to talk a little bit about internships. Now, HACC does have a paid internship opportunity, and we will talk about this during the program. Those internship opportunities are with UPMC Central PA, Lehigh Valley Health System in Allentown, Penn State Health, that's at Holy Spirit Medical Center and Milton Hershey Medical Center, and WellSpan Chambersburg. You are not eligible to go into the internship until you've been in the program for 1 year. So you will be taking an exam in November and applying, and then the internship will start December 1st. So you have to take and pass the written exam. Then you have to apply at the institution in which you wish to do your internship, and you must pass their interview. And you must enroll in an internship class and pay that tuition. And as I said, we will talk more about this as we get closer to that time. But I do want to point out about UPMC internship. If you look for UPMC, you will see a respiratory assistant position. You must be very careful with this position, because if it is an equipment tech only position, that is fine. But if it is doing patient care, do not do it. Any HACC student participating in the UPMC internship that is not through HACC will be reported to the Board of Medicine for practicing without a license. You will not then get a license as a respiratory therapist. So no matter what anyone tells you, you may not do any respiratory patient care while you are in the program unless you are doing it through clinical or through our internship. If you have any questions about this, please speak to me as soon as possible. Also want to touch on HACC's medical marijuana policy. Federally, marijuana is still considered a controlled substance and is illegal. HACC's medical marijuana policy states that if you test positive for marijuana in your drug screen, you will not be allowed to be in the program for that year. It does not matter if you have it prescribed. This has been tested, has gone through the Pennsylvania Supreme Court, and they have upheld our policy. Because we receive federal money, we must follow that federal law that says it is illegal. So just because it is legal in the state does not mean you can do it. It's really no different than if you drink. Alcohol is legal in the state, but you cannot go to work under the influence. You will be required to have some certifications while you're in the program. First off is the American Heart Association Basic Life Support. This will be required. We will talk more about this during orientation. And you have to have it done by the end of February once you have started in the program. You will also be required to get American Heart Advanced Cardiac Life Support, ACLS. Now, this is done at the beginning of Respiratory 210, which is critical care. And we schedule you as a class. You may not take this anywhere else through your employer, whatever. You must take it here with the rest of the students because it is a condition of the class. Same with American Heart Pediatric Life Support, and that is required during Respiratory 270, which is the neonatal pediatrics class. We do have a clinical uniform. The HAC clinical uniform can be purchased from the HAC bookstore. They are a forest green scrub with the HAC logo on the shirt. You do not have to buy the pants from the bookstore, but they must match color, and that can be very difficult to do. You are not required to have a uniform in your first semester in the program, but starting in the summer of the program, you will be required to wear your uniform anytime you are at clinical or anytime you are on campus for lecture or lab. If you want to purchase it earlier and start wearing it in the spring, that is fine. But note that you want to purchase more than 1 or 2 pair since you will be wearing them almost every day. Sneakers. As a respiratory therapist, the one big thing is do not skimp on your shoes. If you are going to spend money, this is where you spend it, because you could be on your feet for 12 hours straight. So you don't want it hurting your back, you don't want it hurting your knees and your legs. So get sneakers that are great quality. They should be primarily white or black, nothing extraordinary. They cannot have open toes. They cannot be Crocs or anything like that where the back of the heel is not covered. You will also be required to have a stethoscope. Now this you will need at the beginning of the spring semester, and I recommend that you purchase your stethoscope through the bookstore. Many students say, well, I want to get a Littmann stethoscope. Well, Littmann stethoscopes are about $150 a piece, and until you get used to carrying it around and not laying it down and forgetting it, because they do grow feet and walk away. So you want to make sure that you are just using a regular stethoscope from the HAC bookstore until you have graduated. Pregnancy. If you become pregnant while you are in the program, you must notify the Director of Clinical Education. You will be required to provide us notes from your OBGYN for any limitations that they may want to put on you. Now, we don't need a note that says you need more frequent bathroom breaks or that you need to sit down more often. We know of that. But we need to know if there's any special requirements so that we can make sure those are being followed in the clinical. After the delivery, you cannot miss more than 2 weeks total in the semester. If you have to miss more than 2 weeks in the semester because of pregnancy, we may be required to give you an incomplete, and we probably are going to recommend that you recycle into the program the following year. We can talk more about this if you are pregnant. Be aware that we must report this to Student Access Services because it is a Title IX requirement. Professional development. Professional development is a requirement of all respiratory therapists. We must get continuing education, and so we start getting you into the habit of doing various tasks to give back to the profession. You must have 5 professional development credits before you can graduate from the program. They are a requirement of graduation. And these are things that are done outside of your normal clinical requirements. Usually volunteer. Now we will open it up if we get requests for certain things. We may open it up for professional development to you. But be aware that anything you want to have count as a professional development credit must be pre-approved by the Director of Clinical Education. You cannot just go do it and then turn it in and say, oh, I'd like a professional development credit for this. It does not work that way. We have to approve it ahead of time. So let's talk about some pointers. We've already talked about critical thinking, and critical thinking is actually going to play into the other things that we're going to talk about here. And the one is clinical. You have to remember that clinical is nothing but one big job interview. If you think the managers of the various hospitals don't know each other, don't talk, you are sadly mistaken. Also, the employees at the hospital, the other therapists, the nurses, whatever, they're going to talk about you. And so they can say really good things about you, or they could say not good things about you. And the manager is going to hear about it. So you need to be on your best professional behavior at all times when you are in the clinical site. Trust the process. You are going to have periods where you are going to feel overwhelmed. You are going to feel stupid. I don't know anything. I feel like I'm dangerous. I'm whatever. These are normal feelings, and please come to us and talk about them because we can help you. All right? I'm not bringing you through and trying to fail you. I don't fail students. Students fail themselves. It's like the old adage, I don't give grades. You earn grades. Okay? So we have done this. We know how it works. This is not my first time teaching. And we have actually had students graduate from the program and are therapists. So trust the process. And by all means, if you have any questions or if you need clarification of something, don't wait. Send an email, call, make an appointment, catch me after class, whatever you need to do, so that we can answer your questions so that you understand what you're doing. So remember, if you have not by now applied for the clinical, make sure you go in and do the clinical application. And now we're going to move on to getting into some meat of the course.